one of the biggest barriers that has impacted me as I have went to access care is issues with insurance. So I think especially, for the longest period of time, my parents were helping me navigate insurance since I was diagnosed when I was 6, and you don't necessarily expect a 6-year-old to be navigating insurance on their own. But college was the first time that I started calling insurance on my own. It was the first time that I really started taking ownership of my condition. And it was such a hard shift between my parents doing everything and then having to learn everything on my own in an independent setting. And so I had a lot of learning to do. And I experienced a lot of challenges as I was navigating these systems that were so complex for the first time on my own. And I should say, too, that I was very lucky that throughout childhood and throughout the majority of my disease journey, my parents had high levels of health literacy, which also translated into me being able to pick up on terms that I had heard throughout my disease journey since I was 6. But it wasn't until I had an internship experience in a different state that I realized that things were going to get a lot more complicated than I had previously realized. So I had just started an infusion that I had needed every 4 weeks, then 6 weeks, then 8 weeks for the rest of my life, as my doctors foresaw. And so I was due to get an infusion in Massachusetts, which is different than where I live in Indiana. And so, I had been on this infusion for just a couple of months. So I had just navigated all the issues that I would have with getting insurance to approve my current infusion. And then I got to Boston, and I thought it would be a pretty easy fix of getting an infusion in Boston versus in Indiana. But that was very much not the case. So I ended up having to spend maybe about 17 hours trying to get this infusion approved in Boston so that I wouldn't have to travel all the way back to Indiana for a 30-minute infusion. And so I, spent hours and hours trying to get this figured out so that I could get my infusion locally in Boston. And I ended up having to see a physician at Massachusetts General for them to be able to approve the infusion so that I could get it in Boston. So all in all, it was a pretty stressful process to be able to get something that I had been getting in Indiana and something that only was 30 minutes of my entire life, but took hours to get approved and for me to actually get the infusion. So I think there was a combination of challenges that I faced when getting the infusion. I think part of it was that I was still learning how to navigate insurance on my own. So it was a lot of pressure to be able to figure out who to call, how to coordinate between my doctors in Indiana and my doctors in Boston. But it was just a lot of stress that I had also as a young adult. I was 21 years old. I was doing an internship that was 10 hours a day almost. And having to balance that with trying to get my treatment was a pretty stressful challenge that I didn't foresee. And I know that impacts a lot of young adults who are crossing state lines, whether that be for college, for work, for travel, for the first time. And many young adults who are often very mobile, but have challenges with coordinating treatment in their home state versus where they end up residing for a period of a few weeks, a few months, or a few years.
Just barriers to cost as far as healthcare is concerned. I've experienced them some, but I know many people have experienced them more than I have. One way that I have experienced a barrier to care is just really through prescriptions. And I can honestly say this, prior to, this is really crazy, but prior to my kidney failure, I had some of the hardest experiences with healthcare. Now, when I was a child, I was under my parents' healthcare with my papa, and it was good. But when I became an adult and I was on my own, it was a struggle. It was a struggle to be seen. It was a struggle to have quality. But it was until I almost was dead and I went on dialysis that things began to pick up. But I can remember distinctly this, is I remember when I had a problem paying for a prescription, and I literally made a conscious decision not to purchase my transplant medication. And I remember the pharmacy tech said to me, "You're not going to buy this medication?" And I remember being so embarrassed because I couldn't afford it. And I had tears in my eyes, and I said, can you just hold it? I can't get it this week. I'll have to get it next week. And she said to me, you have to take this every day. I said, I just can't get it. And she pulled me to the side and she said, I will purchase it for you. And I never forget that in my entire life. She said, I will purchase it for you. And she bought it for me that day. And I remember thinking, the next time I'm in the pharmacy and somebody else can't afford their medication, I will do the same. I don't care if I leave an extra $10 behind. This is for the next person. Look, I'm crying. This is for the next person who can't afford their medicine. Because even if your prescription costs $3.40, people don't realize for some people, $3.40 could be their box of ramen noodles. People don't realize how some people need to eat, and eating oftentimes trumps medication. So I know people outside of myself who make the decision between insulin and food, an anatomizer, and cereal for their children. People make choices every day, and healthcare costs. Going to the emergency room costs. Going to a doctor's appointment costs. It's not for free. I don't think people notice it, but it is not for free. And just a copay can be the difference between paying rent and being kicked out and staying in a home. It's that serious.
I have been chronically ill for most of my life, but it's exacerbated in the last about 6 or 7 years. I have chronic pain, daily pain. And I also have chronic migraine. So those days I am pretty much not functional. I can't go out and do grocery shopping. I can't really take care of my children the way that I'd want to. It's really interfered with the trajectory I thought I saw happening with my life, just because of the pain and the instability of knowing when I was going to get sick or not. With the type of conditions I have, I've needed a lot of additional supports, such as a variety of specialists. I've also needed a social worker and mental health provider. And I found it very difficult, in particular, to access a social worker and some of the specialists I needed. It was really delayed being able to see specialists, even when I was kind of in crisis. And then when I'm trying to talk about a social worker, I really needed them to help me with finding providers, setting up appointments, figuring out where I would be getting my medication from, or how I could afford my medication, or how I could afford different appointments, or even get to appointments at all.
If I was designing a healthcare system, it would include access to healthy food, and that's especially for those who live in underserved or impoverished areas. You know that health food deserts are a reality. And if we really want to give our children and our communities a chance, we have to do so by first providing healthy food so that their bodies can grow and so that the food can nourish as it's supposed to. Clean water. We know we've heard many stories about inner cities where the water systems are damaged. The water is not clean, and the children and adults have access to unclean water. This healthcare system will also have access to treatment where no one is turned away, where someone is not turned away because they cannot afford a certain treatment or a certain medication.
If I was going to design a system that was value-based, I would improve patient-provider communication. I would start with children in schools and teach them how to talk to a medical provider in a way that can get them better access to care in a proper and timely manner. I would invite all stakeholders to the table. With my case, I had to create a team environment when it came to getting the care that I needed, and I would help other people design a way to bring value-based healthcare to the system by using team effort and having all of the stakeholders involved talk about what is best for this person's individualized care. Otherwise, you get skipped over, or the doctor looks at what their specialty is and that's all they're looking at, and they don't have the input from somebody else that looks at another system of your body to say, wait, if you do X, it could equal Z, but it also might equal W and Y, which we don't want to do because that will affect the long term of this patient in these other ways. So I would create a system that is team-based as well as educates the patient just as much as the providers, the insurance companies, and the people that are making the laws to govern healthcare, because a lot of times they make a law that doesn't necessarily compute into giving individualized access to care for patients that are especially the long-term chronic care patients. The system is not designed for us, so I would rebuild that design.
So misaligned values, I think, are a huge thing in healthcare. We talk about patient centricity, but we find that patients aren't really the center of their own healthcare, even though we like to think so. And with technology and everything the way that it's going, we're in such a rush with this amazing things and how we can save people that I think the misaligned value is that in our rush and our attempt to save people and save these lives, we're not even realizing what we're saving. And so I think really just looking at an individual patient before we start and before we do anything, talking to them about what they want in life and what they're looking forward to, what their quality of life is, and how these things can help them, rather than rushing to a decision on how we can save them. Recently, I had an implanted heart device that I regretted a little bit afterwards, right? Because I have DNR in my charts, and it was a decision that I made, right? Because the technology was great and I was so excited about it. But I signed on now for another 9.5 years of I cannot die, right? With medical costs climbing, I'm now in a situation where I am forced to be alive, not even knowing how to survive. So I think as we move forward and we look at our healthcare system and saving people and how we work with people, we have to really know what they're willing to do. Because what if I was a patient that realized 9.5 years and I'm alone, and now I'm going to, I don't want to say it this way, but now I'm going to go kill myself, right? And that $1 million that we just spent to save somebody's life because it was the right thing to do really wasn't.
If I were to design a healthcare system that was more accessible through the use of technology, I think that system would put the patient truly at the center. And what I mean by truly at the center is making sure when you're a cancer patient, I had at minimum 6 physicians in my care team. I was also dealing with high blood pressure. I had my PCP doctor. I had my breast surgeon, my oncologist. I had my radiation physician and technologist. So you have all of these different physicians and doctors. You have your pharmacy, you've got your payer organization. So you have this huge clinical ecosystem. And at what was probably one of the most stressful times in my life, I had to be the red thread through all of those silos. Every time I went to a different physician, I had to create fill out similar paperwork. I had to tell all of them over again what medications I was taking and what frequency and in what dosages. If I was having any symptoms or side effects, I had to regurgitate that information 4 or 5 times to different people and sort of make sure that it was all woven together and consolidated. And technology exists to make it not that difficult. And so I would definitely design a system that puts the patient more in the driver's seat, and everybody sort of plugs into the patient in a way that allows the patient to really be able to make informed decisions about his or her care. So that's sort of where I would start. I think patients, we say a lot that we want to put patients at the center of the care and of their care, and we might be doing that, but I think the center right now just seems to be a very fragmented and chaotic place, and the patient is having to navigate all of the various components to coordinating their care. And I just think we can do better than that. I think technology enables us to do better than that.
I spoke up to this doctor. He told me that I was wrong and that he sees this a lot in girls, which was hard to hear. And I was kind of once again left on my own to try and find answers and find next steps. And that definitely increased the time that it took for me to really receive a proper diagnosis and proper treatment, and then finally begin to regain my quality of life. Finally, when my POTS symptoms began to appear, I was led to a cardiologist who really took the time to look at me holistically, and because he had treated many patients with POTS, was able to see the connection with Ehlers-Danlos syndrome, and was able to refer me to a geneticist to really be evaluated for that condition, which was great, but it's also not something that it took a while for that to happen and to find a physician that was able to do that or had the knowledge and resources to be able to do that. So specifically thinking about navigating the healthcare system and the transition from pediatric to adult care, I definitely think that technology could play a big role. That sort of was what I turned to individually when I was in that situation. So I think that patients are kind of starting to build that outside of the healthcare system. I think that technology could be used within the system to help develop, whether that be a database or combined resources from different systems across the country in order to give patients some tools and options for when they leave pediatric care. I think that technology could also be used to help pediatric providers connect with the patient's next adult provider, so that there's communication and sort of a facilitation of that transition, and the new provider is able to have even a conversation with the previous provider to really get a holistic view of the patient and their entire patient history.
When I got my diagnosis and I thought, great, I'm in the clear, I have a diagnosis, so this means treatment and done. And unfortunately, that's not how the system, the healthcare system works. And it's not how I thought I was going to get treated. And it was probably another 8 months of really, really difficult symptoms again, and not being able to access the treatment that I needed, that I saw other people getting that had the same disease as me, and that were getting specialty care and getting treatments that were maybe new or different, but they were like trying them with these new patients and they were getting like top of the line treatments. And I wasn't able to access any of them and felt very, very stuck. And then about a month after, 8 months to like 9 months later, I collapsed basically at home, and my heart rate went up to 165, and I couldn't hear or see or breathe anymore. And I collapsed to the ground and pretty much thought that was it. And it was in that moment that I finally got the care that I needed, because I was finally believed by my doctor that something was going on. I experienced a lot of racism. As soon as I stepped into a hospital, an ER room, a medical doctor specialist, I was immediately treated so differently. They wouldn't prescribe medication for my pain because they thought that I would use it and abuse it and that I would get addicted to it. And I was in severe pain, so it felt so confusing to me. And I was not asking for a lot. I don't have a history of drug abuse. Like, I couldn't understand why that was happening. And then as far as my pain, when I did come in with pain, they would deny the pain. So they would say, like, it's not that bad, or like, you can handle it. And again, I think that dates back so far in history, as opposed to like Black people being able to have a lot of pain and be okay, and like, we can withstand it, and all these things that I found like extremely racist and embedded in the medical care system.
Living with sickle cell anemia as a child, it was painful, and I did have a lot of support. The nurses and doctors were fantastic, and their goal was to make me feel better. But once I transitioned into adulthood, I felt abandoned. I felt neglected, and I felt that no one wanted to hear me, and I wasn't believed, and my pain wasn't real. As soon as I turned 18, I was put into a category of being a drug seeker, a faker, a problem, an angry Black woman, someone who was aggressive, and it really affected the way I viewed myself. When I later would not go to the hospital when I was in pain, I would suffer in silence, and to the point where there were many times I almost died because I wasn't believed. And even till this day, when I go to the hospital and I'm communicating with a doctor, there's still a piece of me that I still experience disrespect. I'm still disregarded. I'm still, there's still bias. There's still a lot of racism.